हेलो माई सेल्फ मीनू एंड अभी हम लोग रेडियोग्राफी इन स्पेशल सिचुएशंस को देखने वाले हैं जो कि इमरजेंसी रेडियोग्राफी पीडियाट्रिक एंड मेमोग्राफी है। एंड इमरजेंसी रेडियोलॉजी क्या है? सो मेन एम इन द इमरजेंसी रेडियोग्राफी इज टू रेडियोलॉजिकली डिमॉन्स्ट्रेट द इंजर्ड पार्ट विथ मिनिमल मूवमेंट। इंजर्ड पार्ट को मिनिमल मूवमेंट के साथ रेडियोलॉजिकली डिमॉन्स्ट्रेट करना इसका एम होता है। एंड प्रिंसिपल और पोजिशनिंग क्या क्या हो सकते हैं? सो द फर्स्ट प्रिंसिपल इज टू हैव टू प्रोजेक्शंस एट 90 डिग्री टू विच अदर ईच अदर एंड द यूजुअल चॉइसेस फॉर दीज टू रेडियोग्राफ्स आर AP and lateral view of the concerned region, and this is achieved by horizontal angulation of the central ray and corresponding placement in the film without any manipulation of the part. Some situations where accurate positioning is difficult, oblique or distorted view may be accepted. And second important aspect in emergency and trauma radiography is to avoid missing out of any pathology. Therefore, use of larger films, multiple films for the small part is acceptable, and thus both the proximal and distal joints of a long bone are requested to be radiographed should be included in radiograph so as not to miss fractures. If this is not possible, at least joint near the site of injury should always be included while doing radiography of the limbs. And this concept is also applied to the chest and abdomen radiographs. The entire thorax or should be covered in the radiographs where though two films are required to do so. Patient in emergency situation cannot be made erect, and therefore radiograph has to be taken in supine position using a horizontal beam for obtaining lateral radiograph. For example, patient with cervical injury. And use of grid is mandatory in cases of swelling of the part of the radiograph where the part measures more than 10 centimeters. And emergency and trauma radiography involves the use of mobile or portable radiography. Therefore, special precautions are to be taken to protect other people in the ICU or wards. So, in trauma setting, higher factors are used for cost. Factors are increased by 5 to 7 kVp for dry cast, and 8 to 10 kVp should be increased for wet cast. And pediatric radiology. Radiography examination of children is challenging, requiring additional care of the radiographer due to risk radiation, physical and psychological risk to the little patients. And for examining the children, one has to be kind and sympathetic towards them and understand the intellectual and emotional maturity of children. And risk in pediatric radiology. So there is first of all radiation hazard. So bone marrow, which is active in formation of blood cells and distributed throughout the skeleton in children, can be damaged by the ionizing radiation. Therefore, measures are taken to minimize the effect of radiation as follows: use proper immobilization devices to obtain radiography, thus avoid need of repeat exposures due to motion. And the use of gonadal seals for protection of testes and ideal lead aprons to protect sternum gonads and should be used whatever feasible. And physical risk, optimum exposure factor should be set before the child is positioned on the table. And for neonate warming devices should be present to prevent problems of changes in body temperature in them. And one should be well versed with signs and symptoms of adverse reactions to contrast media and how to deal with them in children. And psychological trauma. So children's fear hospitals, doctors, nurses, technicians, toys help them to adjust to the strange environment of a hospital. And infants and majority of children cry when taken to from their mother but usually calm down quickly when parents remain with the child and examination room. And radiographic equipments, one mobile unit should be stationed for use of neonatal surgery, and cassettes used in neonatal ICU should be kept extra clean and wrapped in disposable plastic bags on sterile sheets should not be used in other areas of the hospital. And approach to parents and children. Approaching the parents, if the child is enough old, an examination should be explained to him as well as along with the parents. If the child is young to comprehend direct the explanation of the parent, as parents are understands words spoken in soothing tone, so should be used in communication. Parents in radiography room should be protected from scattered radiation using lead apron and lead gloves. And approaching the child, so infant who are well fed up, happy, playing, sleepy or allow a good examination unless painful, and children between 6 to months and 2 years fear pain and separation from parents. This age group requires immobilization techniques and parents presence during the examination. And children between 2 to 4 years are very curious and can test one's patience and imagination. There, these children may be shown how collimator light works, told that the X-ray is like a camera and will not fall on them. And phrasing a child, especially between 3 to 7 years, is powerful motivator. Engage children in chatting about their brother, sister, pets, school or popular cartoons. 5 to 8-year-old are accommodating and easy to work with as their anatomical landmarks are easily identifiable. And approaching children requiring special care, so when entering an ICU one must wear a gown because of the risk of infection. Supine films of the chest and abdomen can be obtained by placing the cassette under the baby and under mattress, causing less cooling of the infant. And in premature infants, one of the greatest dangers is hypothermia, leading to the slowing of the heart. So, infant skin should not come in contact directly with the cassette. The room temperature should be elevated 20 to 30 minutes before arrival of the child by use of radiant heaters. And common pediatric radiographs. So, chest radiographs must be acquired on maximal inspiration when the child takes a big gasp air at the end of a cry and abdomen expands or the sternum rises. So, infants and young children are best examined supine. Head should not be turned even slightly to the side as this will make the child oblique. And 3 to 10 years old PA erect projection is used with child sitting and arms over their heads or draped over the X-ray cassette holder. For lateral projection, parents can assist by holding the child's head between the arms above the head. And hip radiography symmetric positioning is crucial. Wet diapers should be removed as they can produce significant